So I'm going to kick us off with a land acknowledgement. We'd like to begin by acknowledging that the 2025 National Conference on Ending Homelessness is taking place on unceded Indigenous lands. The Kanakahaka Nation is recognized as the custodians of the land and the waters on which we gather today. Teotihuacan, Montreal, is historically known as a gathering place for many First Nations. Today, it is home to a diverse population of Indigenous and other peoples. We respect the continued connections with the past, present, and future in our ongoing relationships with Indigenous and other peoples from coast to coast to coast. All right, so we have simultaneous interpretation right now. If you need interpretation, you can go to basically the escalators and you can pick up some headphones there, and you'll be able to listen in French because all three of the presenters are speaking English. So we're going to start with Mike Sikora to kick us off. Go for it, Mike.
Thank you very much, Mitch, and thank you everybody for allowing us to be here. I come to you today from British Columbia, Abbotsford, the traditional territory of the Lucamo, the Mathway, and the Samath First Nations, and it's really great to live there, play there, work there, but also to leave there and come here. So thank you for the opportunity. Please forgive me if I think at home right now it is 7:30 in the morning and I got up to the equivalent of 4:30 in the morning. So I'm going to use two hands here, one to change my clicker and one to change my slides on my iPad. So I'm going to try to keep up. As I said before, and as Mitch said, my name is Mike Sikora. My background, a little bit of that is I am a registered social worker. I've worked in the field for approximately 20 years. I've been in the nonprofit world, worked for treatment centers, and for the last 10 years I've worked for municipal government. My role is Senior Manager of Housing, Homelessness, and Community Development in the city of Abbotsford. I also shamelessly, and I'm humbled to say that I spent about a decade in homelessness and with severe substance use issues, and so I'm very grateful to have that as a little bit of an underpinning or background for my worldview. A little bit of stage setting, because I know we are at the Canadian Alliance to End Homelessness conference. I know that a lot of it is targeted around housing and homelessness, which this is as well. I come from a community that's approximately 170,000 people. We did our recent point-in-time count in October of this year, and I think it was 654. Now, it was only an enumeration. Last year, we got 465. Now, grateful for the opportunity to maybe revise how we do the count, capture the numbers, and so it really was more of a reflective of our homelessness challenges in our communities right now. One note that I wanted to point out of the PIT count data from 2024 was that 78% of the individuals that we talked to in that count identified as having substance use as part of their journey, substance use and addiction. So quite prevalent for those individuals that answered the survey or completed the survey. I also want to acknowledge up front that some of the language that I'm going to use in the presentation is directly from frontline workers, and so we wanted to make sure that we are authentic in how we present the data that we collected. So there's going to be some language in here that might not be as professional as we might hope to hear, or we sometimes hear when we're sitting in our offices or at professional meetings, but this is the voices of frontline workers in our communities. Again, recognizing that there are many things and many factors when we talk about homelessness, and whether it's economics. In my community, an average one bedroom is $1,400, $1,500, but income assistance check rent portion is $500. Substance use factors that might allow us to get into housing, but then through some of the relationships and the outcomes of those deep relations with substance use might cause us to lose that housing, or just relationships in general. So there are a lot of factors, but today, and the research we're talking about is focused on substance use access services for people specifically experiencing homelessness. And so with that, I'll just jump right into it. So yeah, we've already messed up. Presentation. The purpose today is to present key findings of our research and then discuss how we can transform that research into knowledge translation. Too often research ends up sitting on a shelf. And our goal was to create something that can drive change, not just describe problems. And then my third piece and purpose today is explore how evidence-based storytelling can shift narratives and support system change. When we highlight, grab some water. When we highlight the experiences and voices of people on the ground, both the clients and our frontline workers, we can open doors to new opportunities for action. And that was the whole purpose of this. We know, we hear, those of us that imagine a majority of us working in the field, we hear things all the time, but when we can take the data or the narratives that we're hearing and put it onto something we can stand on, then we can use it a lot better. And so qualitative research today that is going to talk about some of those stories. The toxic drug supply, delays in treatment, and limited access to beds leave people experiencing homelessness in prolonged and dangerous way. This isn't just one person's experience. The tone echoed throughout the interviews. Raise critical questions. How can we do better to understand what's happening so that we can improve access and outcomes? That's what's led to this research. And you'll hear throughout, again, these are all voices of frontline workers. So to start, the City of Abbotsford, we partnered with the Centre of Advanced Health Outcomes, which is a research branch of the University of British Columbia, and a network of local service providers to better understand where substance use services are working, where access breaks down, and what we can do better for people experiencing homelessness. Our purpose was to understand what happens when people try to access substance use services, what works, what breaks down, and what can be done differently. It was a locally driven effort with representatives from our municipality, local organizations, health, housing, harm reduction, and peer-led supports. Basically formed an advisory committee. There's roughly 9 organizations that were part of that advisory committee for the project. And again, the key principles being solutions must be informed by the people who live and who respond to it on a daily basis. Our methods, we used a community-based participatory action research method or approach, meaning the community was involved in every stage of the process. The focus was always on action and response. We chose qualitative tools, so focus groups, semi-structured interviews, and participant observation to capture real experiences, not just numbers on papers. Frontline workers were the study population because they often access services on behalf of the people they're serving. They see where the system breaks down and what's needed to reduce harm and improve access. This approach set up next steps that we're underway or exploring what that looks like right now, which is the actual journey mapping of case studies of the folks that are working through the systems. And very excited to be doing that right now because it's going to take this whole project to another level. And so we visualize how people move through or get stuck in our system right now within our health authority. The following research questions guided our activities. 1, how do professional service providers accessing substance use services on behalf of their clients, people experiencing homelessness? 2, what barriers and facilitators to accessing services do service providers most routinely experience? 3, what resources do they use when accessing services on others' behalf? And 4, how do these experiences, barriers, or facilitators and resources influence substance use services for their clients? And rather than focusing on journey mapping lens on one particular service, these questions were designed to generate insight into the experiential journey of individuals across the broader systemic lens. And so it was very broad, and we didn't drive the bus on where people went. We asked very, very broad and loose open-ended questions, and it was very interesting, the outcomes. So we started in mid-2024, and the interview and the process went to late 2024. In total, there were 49 participants represented, and they represented a broad range of frontline perspectives across Abbotsford. Data collection included 27 semi-structured interviews, 4 focus groups, and 4 days of field observation where trained anthropologists followed along outreach workers in the field. From a qualitative research perspective, this is a great sample size. Participants came from health, housing, outreach, peer, shelter, and criminal justice sectors, offering diverse insights into access and service navigation. Almost half, or 41% of our individuals, had more than a decade in the field. So well-versed, knew their stuff, and had varying perspectives of that based on the diversity. For the individuals that we interviewed, most of them had reported that they had stability, access to mental and emotional supports, and a sense of financial stability. However, the high stressors of the role were clear. This points to the future work that we're actually looking at doing right now, which is a sub-analysis focused on supports for frontline workers. Participants, those frontline workers that we interviewed, reported engaging with a wider range of systems in their roles. And you can see on the slide behind me The most frequently accessed systems were, the top three were police, hospital, and mental health, followed by outpatient substance use services, then MSDPR in our ministry, is that a province or federal? Income assistance, and inpatient substance use services, followed by corrections and MCFD. So those are the services that our population that we interviewed most actively engaged in. Smaller numbers reported engagement with private substance use services and other systems, reinforcing how frontline workers, again, that work cuts across many institutional boundaries. The distributions emphasize the diversity and interconnected nature of the workforce supporting people experiencing homelessness and using substances. Again, if you're out there in the field, you're not an expert in one, you're an expert in many different things, and we saw this firsthand when we did this research. What are you looking at? The ontological framework. Really, it captures the complexity of how people experiencing and navigate substance use and homeless services, what it looks like. It's more than a diagram. It's a way to visualize how different realities, pressures, and interactions shape outcomes for people seeking help. Developed through qualitative analysis and interview and focus groups, it illustrates the relationship between key concepts that emerge from the data, showing how certain forces reinforce barriers while others help create openings for change. And we know that there can be some huge barriers, but there's some great opportunities out there as well. The framework isn't meant necessarily to simplify a complicated reality, but to make it visible, revealing how access, environment, motivation, and systems intersect in ways that often keep people trapped in cycles of instability. We refer to this as the vortex effect when we talk about it. It also helps us see where the points of intervention, moments when relationships, timely response, and better coordination can shift a person's trajectory. And for reference, if at the end of the presentation, I'll have a QR code up there as well. You can go to our website, and there's a number of videos, and then the full reports are up there. If you want to read it, there's an executive summary and then the full report. Lots of words on a screen, and I don't expect that you can read all these things. But what you see here first is part of the ontological framework, a snapshot of how environment, motivation, housing, and access interact to shape people's journeys and when they try to engage substance use services. At the center are the words hopelessness and death. And I don't want to be dramatic here, but this is the sentiment, what workers described as the inevitable outcomes when the system fails to respond. These are the conditions people are navigating in real time. Each quadrant behind me shows a contributing pressure. Environment, resource poor, unstable, often dangerous with toxic supply everywhere. Housing, limited, precarious, often inaccessible for people who are using or in early recovery. Motivation, constantly under pressure. People want change, but it's complicated by trauma, relapse, and a lack of timely supports. And finally, access, full of rules and requirements that don't match the realities of street life. A challenge. So we go back. The main barriers linking these pieces were drug toxicity, instability or lack of housing, lack of resources, the nature of substance use disorder, and delays in service provision. The framework shows how people aren't just struggling individually, they're being pulled into instability by the design and timing of a system that's meant to help them, the vortex. Now, if the last slide showed the forces that drag people down, this slide shows the few that can pull them out. 3 major focus areas or factors stood out across every interview and focus group. Number 1, relationships. Relationships between workers and clients, between workers themselves, were the single strongest facilitator of access and recovery. I think we can all, look back at a time of our lives where we had that one person or 2 people in our lives that helped us get through something really tough. This stood out in all of our interviews because we know that folks that are out there experiencing homelessness, living through substance use, often really lack that. And so when we can provide that for individuals, it was a very strong predictor in success, whatever success looked like. Number 2, timely resources, meaning the right support at the right time before motivation collapses. 3, stability. The one thing that makes everything else possible. When people, or even staff, have stability, everything changes. In our world, that's often housing, or it can be services, or it can be a place to stay. When you're living in a tent, when you don't know what time it is, when you don't know where you're gonna eat your next meal, or how you're gonna protect your stuff at night if you have to go somewhere, that's not stability. And so it's really challenging to work through some complex systems, make your appointments, make your phone calls when that is your scenario on a day-to-day. Each of the facilitators, recognizing they live in tension with system realities. Relationships are strained by burnout, timely resources are rare, and stability is fleeting. So this part of the framework isn't just about hope, it's about leveraging points. These are the areas where real investment and coordination can actually change the outcomes for individuals we walk beside or walk alongside. What you see here are the most commonly reported barriers at the points where people try to access substance use services, particularly detox and treatment. And as I said before, we didn't drive people to talk about detox and treatment, very open. We didn't know if we were going to talk about harm reduction or opioid agonist therapy or what it was, but all of the interviews went to the same place, which rang really loud and clear for us as a municipality, that something we need to stand on and advocate for more of. Frontline workers told us that they understand why some of the systems and rules exist, but the lack of flexibility in how they're applied often prevents people from getting help when they're ready for it. Six key barriers. Number one was delays. When someone is ready for detox or treatment, it's an emergency. That readiness window closes quickly and people are often back to the streets. Number two, dovetailing treatment and detox. And I'll talk a little bit more about these in slides to come. People are often required to have a treatment bed lined up before entering detox, which just isn't realistic for those without phones or stability. Unrealistic resource requirements. Basic assumptions like having ID, phone, or transportation makes access nearly impossible for many of the folks that we're serving. It's really tough when you can't find an individual to make a 10 o'clock appointment when you start at 8:30 and they've moved 3 times in the last 5 days. No way to contact them. So things like that. Referral restrictions. Centralized system. In our area, there's a centralized system. You don't access the health authority resources without going through their centralized system. And so we've lost some of that relational opportunity or capacity to get people into places where we need to go, because you have to go through a rigorous screening process and then hand it off to another centralized system within a giant health authority, rather than the one-to-one work that we used to have. So we've lost a lot of that. Drug of choice limitations. I was having a conversation earlier on around detox, and people who use multiple or changing substances often can't access detox because the system isn't built for that complexity. In our health authority, I think there's approximately 2 million people served. We have 24 licensed detox beds, withdrawal management beds. And so if you're not facing complicating, life-threatening opioid use, you don't get a detox bed. It doesn't matter if you've been up for 14 days smoking crystal meth, if you're drinking a 60-pounder of vodka a day, the list is long, and the people they choose are very, the population is much smaller than the needs are in our area. And finally, complications with OAT, or opioid agonist therapy. For some, OAT feels mandatory rather than optional, becoming another barrier when someone wants recovery-focused treatment. We heard this one loud and clear. People that are ready when they pull the trigger to get out, they don't want to go from one drug to another drug, even though many of us in here understand the titration and what that looks like. Sometimes that's a hard sell for people that just want out and want to stop. And so that placing those requirements on getting into some of the services based on where you are was a huge barrier. These examples show how policy intent doesn't always match real-world impact, and how even small delays or rules can close the windows of opportunity for change. What you see here is where we start moving to a little bit of description to meaning, what's happening and why it matters. This is where thematic analysis brings the meaning making to the data. Instead of just identifying barriers or facilitators, we started asking, so what? What do the patterns tell us about how the system functions and what needs to change? Themes that follow describe the most significant relationships between the components of the ontological framework, things like housing, motivation, environment, and access, and how these relationships shape the real world, trying to engage with substance use services for people experiencing homelessness. It's tough. We all know that. It's tough. These themes take us directly into what frontline workers told us most urgently, the patterns that point to opportunities for system change. This theme's blunt. I said it, 24 detox beds. There's no balance between needs and supply. Frontline workers said it over and over again. I don't understand why there isn't more. The demand for detox, treatment, and housing far exceeds what exists. And again, from my stage setting, I think we have 204 shelter beds in our community and 650 people counted experiencing homelessness. We know that's an undercount. 24 detox beds in our authority for 2 million people. We have 2 men's and 1 women's licensed treatment center. We have a whole host of faith-based treatment centers, and they provide a very great service for folks. But sometimes, and when you're working within the system that is, they don't even validate those or allow folks to go through this, so they can only go through their doors. And so, again, the balance between need and supply. One partner noted, if I could pick them up and take them to detox myself, I would. It's so hard to get in. I experienced that. I have a brother who has 20 years in opiate addiction, and I'm very grateful. He's got about 5 years sober now. And I couldn't get him into detox, and I know people. I had to have him detox on my floor with my 5-year-old twins running around and being sick as all get out for a week and a half in my house because I just couldn't get him into detox. I couldn't get him into emergency to take the screws out of his mouth because his jaw had been broken. I had to sit him on my toilet with a cordless drill and take screws out of his mouth because the emergency room wouldn't take him because of his substance use issues. What's even more concerning is that while homelessness and substance use have both escalated, the actual number of detox and stabilization options in our area has actually declined. In my time in the field, I've seen an entire detox program closed with around 20 beds. Mobile detox funding disappear, stabilization beds, both pre and post-treatment, eliminated. So while the number of people sleeping rough or sleeping outside or cycling through shelters has grown, the system capacity to help people has actually shrunk. This means people not only waiting for longer for help, but never getting it. And when someone living rough says, I'm ready, we know there's not a lot of time. We need to get to them now. So what we're seeing isn't a system necessarily built to fail people, but one that's structured in ways that is failing them. It's designed to manage scarcity, not meet demand. And again, this research isn't about proving shortage. We know it exists. It's about showing what the shortage costs in real lives and lost opportunities. Frontline workers and the people they serve need beds, options, and urgency. Result number 2, or theme number 2, time. Time and delays are killing people. When someone says, I'm ready, the clock starts ticking. We know this. Every hour matters, but in reality, by the time someone goes through the gauntlet of access, if they make it through, a detox bed opens, that moment is gone. We received a check, we've seen a friend, we've had an opportunity to move from my conversation with my outreach worker to somewhere else. I know one outreach worker in our community, she has a wall of names of people, and there's far over 100 people that have died that she works directly with in the last 10 years, and her role is getting folks into these services. And so it's a big struggle. So the time delays. People don't die or remain entrenched in homelessness or addicted to drugs because they don't care. They often stay there because the door was closed when they knocked. We hear it over and over again. It's easier to stay living on the street and severely addicted to substances than it is to get out. That shouldn't be. Frontline workers said the system needs to act like a medical emergency. We know this. Number 3, and there are 5 of these, and then we're almost at the end, is every frontline worker described the poisoning drug supply as the backdrop to everything. The drugs are strong and unpredictable, too toxic. A couple of quotes from folks is, I've seen people lose over 40 pounds. They act like children now. Everyone looks like a zombie. It's really bad. Those aren't things that we want to see, we want to hear, but we see it. We see it on a daily basis. Fentanyl isn't the same problem we had 10 years ago. It's a death trap. People can't detox on their own. They can't taper down. Without a safe, stable place to live or access to inpatient withdrawal management or treatment, there's no path out. One participant said it best. Just by the strength of what's out there, withdrawal management is necessary for a lot of people. We know this. This isn't about willpower, it's about chemistry, and the chemistry is lethal. Theme number 4 is you can't get off the street drugs if you're still living on the street. That one's pretty clear. People trying to quit are surrounded by chaos, violence, and constant triggers. Detox without stable housing isn't recovery, it's a revolving door. Treatment without stable housing isn't recovery, it's a revolving door. What's the point of detox if we just send them right back to the same conditions? I've done many a referral from the nonprofit world, 60 days out, right back into the food lineup with the guys that we were smoking meth with when we left. It's tough to watch. We built a system that pulls people out, crisis for a week, 2 weeks, 4 weeks, then drops them right back into it. It's not stabilization, it's abandonment. It's one of the quotes. Real recovery starts with a roof and a bed. Starts when we have access to a roof and a bed. Now, that's not as black and white as that sounds. I mean, our recovery journeys, they go left and right and up and down. I can speak for that myself. But that house and that bed really helps. And finally, theme 5. This is where hope lives in relationships. Workers said that relationships are the glue that holds the system together. The one thing that still works when everything else fails. Trust is a huge thing. One quote said, "Learning to trust one person can anchor someone long enough to take the next steps." But we're not investing in relationships, we're burning them out. I think we've all experienced that, or we see that in the people around us. Policies don't build trust, people do. Frontline workers are filling gaps that the system leaves behind, but they're not doing it without support. If they're doing it without support, it's unsustainable. If a system collapses without relationships, this one, I find this very important, the relationships aren't soft skills, they're the infrastructure. Without those relationships, we don't move forward. And now, taking that research and turning it into what does advocacy look like? I think it's gonna work, I hope it's gonna work. It is. So this is one of 5 short videos, it's 2 minutes long, that we produced as part of a social media campaign to bring research to life. When we talk about knowledge translation, this is exactly what we mean. Taking data that could have stayed in a report and turning it into something people can actually connect with. Each video, there are 5, features frontline workers, community partners, and people with lived experience. The voices that often get left out of the system conversation. We shared these locally through the city, community partners, and social platforms as a way to start a broader conversation about what's really happening on the ground, where outreach and case management meet encampment life and life on the street. The response was strong here at home. The videos helped humanize the issue, and more importantly, they gave credibility and visibility to the people doing this work every day. They also created an opening for dialogue with provincial ministries and the health authority, giving us a tool that connected story, emotion, and evidence in a way that reports don't always do. This is how we made the research accessible, by taking it off the page and into the community. And when this is done, we'll briefly look at how we're using the research to shape policy discussions, inform grant applications, and strengthen our city's communication when we talk publicly about homelessness and recovery. I hope this works.
You're good.
I do feel the
I don't hear
barriers
sound.
sometimes get to be too much, and people are more willing to give up or stop trying to access the same thing over and over again when they know that the result is always no. I do feel the barriers sometimes get to be too much, and people are more willing to give up or stop trying to access the same thing over and over again when they know that the result is always no.
The help that is available is very, very difficult to navigate for an entrenched person that is living in a tent, doesn't have a cell phone. How are they supposed to call detox every day? How are they supposed to get from one side of the town to the other to meet the doctor at 2 p.m. when they're sitting in their tent dope sick from fentanyl, and they have to do that doctor's appointment in order to get the referral to go to King Haven? It takes weeks and weeks and weeks and weeks for all of this very difficult stuff to happen.
If there's a delay, if there's challenges in navigating the system to get to that, chances are that that opportunity has now been lost, at least for a while.
If we're not investing in that, we're just going to continue to be spiraling and spending money on cleanup and really not accomplishing anything.
So that was an example of one of the 5 videos. And again, if you go to our website, there are 5 of them. There's also a 19-minute version that's a little bit longer. We've had the privilege of showing that to our downtown ADBA and to our Chamber of Commerce and a number of agencies and organizations in just educating. I know for me, it's really easy to drive down the road or walk down the road and have a thought. And that thought is, well, why are they doing this? Or why is it this way? This really reminds me that it's not easy, and I live and I work in this field, and I can forget that sometimes. So for the common individual that has no clue, these videos and this report is something that we've had a lot of positive feedback on how that has impacted them and what that has done for their thought process. I think I have one more slide after this. When community-driven research informs advocacy, things begin to move. While I'd love to say we've already seen major shifts in service delivery, we haven't. What we have seen is increased attention from health authority and stronger collaboration locally. We've had a lot of people come up and say, hey, thank you for adding this layer of conversation. For so long, and this is not at all, I promise you, meant to demonize anything, we've only used the words harm reduction. But now we're able to talk about recovery. We're able to talk about abstinence. We're able to talk about detox. We're able to talk about treatment because they all work together. But for so long we weren't. Those conversations weren't happening. So we know that we have a lot of grateful partners from this. Again, first steps of change is recognition and accountability. From the start, the project wasn't meant to sit on a shelf. We took assumptions and familiar narratives and through ethical, research-approved processes, produced something we can not only stand on, but build on. And how are we using the research? We've handed this, our mayor has handed this to our ministers. We've sent it again to leadership within our provincial and crown corporations that fund programs in our communities. We bring the data and frontline quotes into those conversations to advocate for the needs and resources that our community and our health authority needs. We use this, in doing the Health Canada grant application right now, and this is one of the underpinnings of the things that we put out our request for proposals on. We know we have A, B, and C, but we really need to focus on D, which is the stabilization, pre and post detox. So we're using this research as foundational to the direction that we're trying to go in our community. Again, not without remembering the things that are already there. Media communication. So when the city speaks about homelessness and recovery, we often ground interviews in the data from our frontline and the words of our frontline workers. It's very important to recognize the work that's being done in our community and what our frontline voices who experience it 5 days a week, 40 hours a week, 52 weeks a year, year on year, are saying, because it's important. They're the ones that are living it and working in it. The framework gives a shared language for partners to coordinate on emergency stabilization and pathways. And while I said earlier that increased attention from our health authority, we actually faced resistance. They sadly minimized and questioned our research and tried to discredit it. How do you discredit what 49 frontline workers have said about their everyday experiences? What did that do? It confirmed our work's relevance. Local evidence was taken seriously enough to challenge. Our position is simple. These are frontline workers, their experiences. Ignoring or invalidating them doesn't make it less true. It makes change slower. And this is how evidence has become a narrative tool and a lever for system reform. This quote captures the heart of the project. It's about urgency and trust. Treating people as emergencies when they say I'm ready, and responding not just with compassion, but with action, both in how we respond to substance use and homelessness. Behind every data point is someone who still believes that if the right door opens fast enough, recovery is possible. I mentioned my brother 5 years ago. You saw him in that video. This is a nonprofit he started. Recovery is possible. I'm a strong advocate for that. If there's one takeaway today, it's research shouldn't end in publication. It should end in response. Before I close, I want to say thank you for taking the time to engage with this, how the research translates into real action. The project exists because of collaboration across government, community organizations, and people with lived and living experience, both in the field and out there living this day after day. If any of this resonates with you, I'd love to connect afterwards. There is a QR code up there. It does get you to the full report and the 5-part video series, as well as the 19-minute video. And great to discuss after, and then there's my contact on there as well. So thank you for being part of this, and I really appreciate the opportunity.
All right, that was Mike Sikora. Incredible, very powerful. I'm grateful to call Mike a friend. I've had the pleasure to work with Mike before, and Mike, you're basically a bull in this sector, and really proud of everything you've done, so thank you so much. I'm going to introduce our next speaker. That's Michael Jasek, Senior Advisor, Social Policy, Association of the Municipalities of Ontario. Thanks so much.
Hello, everyone. Thanks, Mitch, for the introduction, and thanks to the Alliance for the opportunity to speak with you today. I'm going to talk a little bit about some work that we've done in the municipal sector in Ontario around advocacy, turning data into action on homelessness. I'm going to talk about the action part of it, the advocacy piece of it, and I'm tag teaming today with Jesse Donaldson from Help Seeker Technologies. That's really going to delve into the data piece. But first of all, to introduce myself a little bit more expanded, I'm a senior advisor for social policy with the Association of Municipalities of Ontario. I work with policy development and government relations, and basically what I do is I advise mayors and regional chairs and municipal elected officials about social policy and human service delivery in their communities, and I've worked in the social services field, including frontline and program administration work, including with the City of Toronto. Okay, so the objective here today, we're going to talk about our case study, and really what we want to do is let you know what we did over the past year. We think it's an example about how we can effectively strengthen the use of evidence in advocacy, and we're going to talk a little bit about learnings that we had from the project as well too. And one of the things I'd like to achieve in addition to informing and hearing your questions is we'd be open to comments and hearing feedback from the audience about what we did and what we might do for practical next steps. In terms of the outline of the presentation, we're really just going to talk about the why, the who, the how, and the what of what we did. Just a little bit about my association. I already mentioned what my function and role is. So the Association of Municipalities of Ontario is here in the province of Ontario. We're a nonprofit association. Basically what we do is we represent the 444 municipalities that exist here in Ontario, and we work on shared goals and common challenges. Homelessness and affordable housing is one of those things that we work on quite earnestly. We are the voice of those municipalities. We do a lot of advocacy to our provincial government and to the federal government as well. And really what our mandate is to improve and strengthen municipalities so they can improve quality of life for residents in their communities. And we're a political organization in that we represent municipal councils and we're overseen by municipal elected officials, but we're a strictly nonpartisan organization. And we work with a lot of community partners as well too. Just a little bit about the municipal role for housing and homelessness in Ontario. It's a little different, I think, from other provinces and territories. Municipalities and our community partners are on the front lines of the homelessness and the affordable housing crisis, and we are interested in this because we know that it threatens the social and economic prosperity of people, communities, and the entire province. A particularly burning issue for us is the rise of encampments in Ontario. According to a survey we did, there's at least 1,400 encampments across Ontario. We don't have a full count of all the people that are living in the encampments, but there's about 1,400, and they exist in all communities all across the province, from rural to urban in Northern Ontario, which I'm sure is similar across the country. Of the 444 municipalities, we have 47 municipalities that are known as designated municipal service system managers. And this includes cities and district social service administration boards, which are local boards, and they are responsible under provincial legislation to develop 10-year housing and homelessness plans, and they co-fund, plan, and administer and deliver homelessness programs with community partners funded directly by the provincial government and the federal government, and in some cases some foundations. And in Ontario municipalities, I think this is where it's different from other provinces and territories, we're directly responsible to fund, deliver, and administer funding for community housing to nonprofits and community housing providers in the province. I would say that, municipalities, we don't do this alone. We don't manage the entire homelessness and housing serving system. The provincial and federal governments also fund nonprofits and Indigenous organizations to provide services such as violence against women's shelters and other homelessness prevention services. A little bit of context. So for our municipal association, homelessness is a really significant priority. We've got 3 top priorities right now. It's around municipal fiscal sustainability, housing and infrastructure and affordability, and homelessness is in the top 3. We place the onus on the federal government or the provincial government. We were trying to work with them toward a goal of ending homelessness, starting with chronic homelessness, and with the provincial government to garner federal support for this. We've advocated for homelessness for a number of years, but we really started a structured advocacy campaign in 2023 with a pre-budget submission calling on the province to address the root causes of homelessness. And to support our campaign, we had released a couple of policy papers, one on homelessness encampments and one on the opioids crisis. So with the advocacy campaign activity since 2023, we did a pretty comprehensive pre-budget submission to our provincial government, again talking about addressing the root causes of homelessness. We did a municipal resolution campaign, and we did a big media push. We also did a coalition letter on homelessness. We worked with 25 different partners across the province, from the social health, education, business, labor, and justice sectors. We asked the Premier and the government to take urgent action on homelessness in 2023. We did see some modest success. We received some increase in provincial funding for homelessness prevention, for emergency responses, and for supportive housing. However, the government framed it as measures to address homelessness. We still wanted to influence the narrative and change it into ending homelessness, but we're continuing to work on that. But this was a good start to our advocacy. And then, we decided that we needed to do a little bit more. We knew our municipalities were under pressure and that homelessness was taking a devastating toll on people and communities, and that it had a cost to people in terms of a human and financial cost. So we set about on a project, a research project, because what we didn't have, we anecdotally knew what was happening, but we needed to demonstrate this through data. We partnered with two like-minded associations, the Ontario Municipal Social Services Association and the Northern Ontario Service Deliverers Association, and we commissioned Help Seeker Technologies to undertake what we think was pretty groundbreaking research on homelessness in Ontario, because it was something that was unprecedented and hadn't been done before. We did have an advisory group that was really instrumental. It mainly included municipalities, leadership staff that were involved in homelessness prevention and affordable housing. We also had other partners such as the Ontario Aboriginal Housing Services, and the Canadian Alliance to End Homelessness was also represented on the Project Advisory Committee. And all of our 47 municipal service managers contributed to this research. They did a lot of heavy lifting for data collection and submission, and we released a report in January 2025. And Jesse's really going to get into the details about that, but I'm going to just talk a little bit about why we did this and what were some of the key takeaways. So, we knew that data was needed in the face of an escalating crisis. We really wanted to do evidence-informed public policy development and sustained advocacy. We didn't really have a good comprehensive profile about the current and future state of homelessness in the province, and we knew that we needed that to inform government decision makers on this issue. And we didn't have a comprehensive assessment of need or an identification of solutions required and the cost estimates of what it would take to end chronic homelessness. And this was all what we thought we needed to put together for advocacy. So we undertook this research objective. It had three major objectives. One, we were setting out to quantify the current scale and scope of homelessness in Ontario, as well as projecting potential growth without additional interventions. We sought to identify and cost solutions at a provincial level to end chronic homelessness to a functional zero standard. And we were also seeking to identify the gap between current municipal, provincial, and federal investments, and to quantify the required investments to end chronic homelessness in Ontario. Jesse will talk more about this, but we were coming up with an order of magnitude number on this. So we did produce a report. I'll tell you a little bit about the takeaways, and we'll get into the data later. Basically, we determined what we already knew, but we validated with data. The homelessness crisis was very severe in Ontario and was getting worse and projected to get worse. We talked about the position of municipalities. As I mentioned, municipalities are involved with homelessness and housing service delivery, and they have stepped in a significant way to address homelessness in their communities despite limited resources. And we asserted that the provincial and the federal government had not done their part, and we would like them to see more. We knew the situation would get worse if we don't take action. We asserted that the level of homelessness was unacceptable. Any level of homelessness is unacceptable. But, given the scale of what we discovered, that we needed a bold and transformative action. And to end chronic homelessness, we also talked about that we needed a fundamentally new approach that was going to prioritize long-term housing solutions over emergency measures and enforcement-based responses. And through collective strategic action, we felt that we could work to solve this issue in our communities. In terms of the research project, the value that it had, it really filled in critical gaps that we had in homelessness and supports our association and our project partners to work on this priority. We were using it for advocacy, evidence-informed advocacy, for policy development, where it's informing policy conversations with the provincial government, and also, to an extent, the federal government. And also, we thought it would provide strategic guidance. As I mentioned, our municipalities have to develop these 10-year housing and homeless plans, and they plan and deliver systems in their communities. So we thought that this data would help to inform local approaches. In terms of what we did in terms of the implementation, we felt that the project was a success. We had the right partnerships in place. We had membership buy-in from our municipalities, and they championed the cause to get this project undertaken. We had real confidence in the data. Help Seeker did a tremendous job for us here in Ontario to produce this report. And we had a solid communications plan. We released a report in January, and we had a set of key messages, a media strategy. We've been briefing government staff, outreach to provincial elected officials, and working with partners to align advocacy. And I think it really shifted the narrative in Ontario. The data that we have and the numbers that we presented in our report are now the definitive numbers and have been picked up by media quite extensively, think tanks, advocacy groups, academic institutions, and political parties in Ontario. In terms of lessons learned and future work, we did affirm the value of the project, though this exercise to quantify the extent of homelessness, the projections, and the cost. It's not a sustainable exercise that we can continue to do on our own. We need to work on periodic updates with provincial support. And we do need that we did realize that there is a need for more work for a province-wide data framework and strategy to be able to build capacity and to increase data consistency and quality. And a critical future step for us is how to work to more accurately profile Indigenous homelessness with Indigenous partners and generating Indigenous-led solutions. Jesse will talk a little bit about the data collection in this area, but our association is committed through an Indigenous Reconciliation Action Plan to work with Indigenous partners to ensure that we can improve this in the future. In terms of continuing advocacy, just a few things. Really with the report that we released, it's really conditioning and we're incorporating the findings into our advocacy to the provincial government for the next budget that'll be tabled in early 2026. We've been working with a broad range of sector partners to align our messaging and make sure that we're speaking with a collective voice as much as possible. Though our association is primarily provincially focused, we do work with our national organization, the Federation of Canadian Municipalities, to try to influence and inform federal government actions. We do engage the federal government to a certain extent. We've been working on the Reaching Home program, trying to assert the value proposition of continuing and increasing the funding for Reaching Home, because Reaching Home is great, but it does not cover every area in the province of Ontario, much like I think other areas in the province. There's quite more of a focus on urban areas. Many of our rural and northern areas do not get the funding, and we would like to see that expanded. Build Canada Homes, we're looking forward to working with the federal government, especially on their commitment to build non-market housing, starting with supportive and transitional housing. And also we'd like to work with the provincial and our federal government about the extension of the national housing strategy beyond 2028, because that's instrumental for us. So in terms of key messages, what we're promoting, we talk about grappling with the homelessness crisis, and we really frame it that it impacts the social well-being, health, and economic prosperity of communities across Ontario. So there's a moral and an economic and a health argument to make. As mentioned before, the complexity and scale of the challenges calls for bold and transformative action, and we're really trying to encourage all orders of government to come to the table and agree on an investment plan to end chronic homelessness. And we've called on the federal and provincial governments to expand investments and particularly around deeply affordable community housing. We've made this argument as a tariff response in a worsening economy that community housing is needed now more than ever, and that there's a good business case for that to house people, but also to increase economic productivity. We're continuing to work with our provincial government to take decisive steps to address the root causes of homelessness, including income support and enhancing mental health and addiction services and long-term housing solutions. So that's work we're continuing in the lead up to our next provincial budget. So in terms of next steps, we did this report with 2024 data. We are going to update the report, and this is underway for 2025. We think that the update will help continue the argument about where we're at with homelessness in Ontario, how it's projected to go in the next few years, and really the report in this update is valuable for us because it's going to serve as our continuing platform for conversation with the provincial government and should inform planning by municipal, provincial, and federal governments with a broad range of partners. That's my presentation. I think this slide deck is going to be available after the presentation. I do have my contact information there. I'd invite anyone, should they have any further questions, to get in touch with me. And look forward to your questions at the end of the session. Thank you.
All right, thanks so much, Michael. Introducing Jesse Donaldson from Help Seeker Technologies. Share more on the exciting work.
Okay, my name is not Mike, but I'm appreciative of the mic starting us off. I'll just start with, as I was walking here, so the last time I was in Montreal was 10 years ago, 2015, when they were doing their first pick count. And it was a year later in 2016, I'm a little shorter, that the feds put out the first kind of coordinated results. And so I'll just give you these numbers. There was 32 participating communities, some of the biggest communities in Canada, and they found 600 people in a single night experiencing, 6,000, experiencing homelessness. 10 years later, nearly, so 2024, the results that came out, on a single night of roughly 70 communities, there's 60,000 people experiencing homelessness. And so while what I'm about to show you, I think is a hell of a data feat, and I'm going to talk about it that way, it's not a good outcome. And I think when we focus on these data projects, we focus so hard on data that represents a system, that manages a system. And my question is, through action, how might we get to data that helps us improve a system, preempt social issues, and frankly, tear down the parts that aren't serving us, because it was never meant to be this big. It was never meant to have all of these pieces. So what will really help people experiencing homelessness or substance use or mental health? So I say that with you today in that it's not just data for me, and I know not for you in the room. All right, quick question, just so I know who's in the room. How many of you are not from Ontario? Boo, Ontario. Oh, good, okay, awesome. So you haven't seen this, good. How many of you are service providers or work at a service provider organization? Okay, cool. And then how many of you are self-proclaimed data nerds? All right, we're good. I'm with my people. Okay. Don't hold the Ontario thing against me. Right, very, very tiny. Can we make it? I'm blind as all hell. Okay, we can't make it bigger. So we're just gonna do our best. So there's three, thank you. Just a little bigger, I don't know.
You need the text bigger?
No, I'm gonna ignore the text.
Oh, okay.
We're just gonna riff on the slides. Okay, thank you, that's
You
better.
good with that?
Yeah, that's good. So there's three parts to this. One, we wanted to enumerate, again, we wanted to represent the system now, and that was important. I don't mean to undermine it, because there were so many different numbers across Ontario, and while we were actually doing the report, I think there was a binder leaked. I can't remember exactly, but there was some astronomical number of the number of people experiencing homelessness homelessness. But then also, if for those familiar in the room, Michael Shapcott, he had set a number of people experiencing homelessness on Ontario, I think like 15 years prior. And that had been the number that had kind of brought up. So we wanted to say, how do we enumerate this accurately? Two was we wanted to look ahead, like I just said. So how might we predict or infer what the outcomes of homelessness might be if we do nothing or carry on the path that we're on now, And then third, what's it going to cost and what do we need to build? Because you cannot have a conversation with any order of government if you can't say how much it's going to cost. And just because you say it doesn't mean you have to pay for it. But if you don't say it, no one is going to pay for it. So shying away from those financial conversations, it doesn't work. So what we wanted to do with the 47 service managers, we had an advantage because the 47 service managers, like Michael explained, do have data. They're legislatively responsible under the Housing Services Act to deliver services. That's not to say there's not a huge difference between the data and administration capacity of, say, a smaller service manager in the north and the City of Toronto. So our challenge was how might we responsibly collect data or get data without having to collect any more from service managers themselves, and how can we get 100% participation. So what we had to do is we did a whole big kind of feasibility piece where we said, what data do you have? What can we make work? And our whole thing was the success of this is 100% participation. So if I have to get rid of something for community X, then we will, because we want to represent the whole picture. We also, that means, had to get fast and loose with our definitions. Okay, you both measure chronic homeless differently. We'll take it. Oh, you only have PIC counts and you don't have annual counts. We'll take it. And then we had to take it all and decide what we could reasonably infer and how might we fill in the gaps. And this applies for any aggregate effort to enumerate homelessness or any social issue. So not just an Ontario context. Then we looked at three, and kind of egg on our face now, we looked at three scenarios, economic scenarios. So how might homelessness change under an upturn? I don't think that's where we are. Economic steady scenario, and then a downturn. That, I think, was one of the more kind of compelling policy points. Really, that's a policy speaking point, but it helps see the kind of consequence of carrying on the path we are. Finally, like I mentioned, we did some modeling, and in the modeling we make some inferences based on the population about levels of supportive housing needed, transitional housing, emergency shelter. I don't actually think we added any of that. And then community housing. And one of the really important things as I kind of rip through the results is it assumes that the system is operating as it should. It would be unethical for us to model the cost and the size of a poorly performing system. It also assumes parallel investments in mental health and substance use, education, child welfare. So one of the criticisms we got on the report, and fair enough, was we don't have enough supportive housing beds in there. I said, well, yeah, because the health system also needs to fund supportive housing beds. The homelessness system can't be the catch-all for a huge dysfunction in the mental health and substance use and health section. I don't know what you think about that. Agree? Agree. See, Mike agrees. All right, let's look at the data. So when my team said, okay, we're gonna get data from 2016, I was like, well, that's crazy, don't do that. They were right, I was wrong. And so we were able to collect that historical data, that 10-year period I was just mentioning to you. And so what we can see is, and this is complete data. So where we had a few data fields missing, we filled them in using, I don't know, statistical methods. But what we estimated, over the course of the year, 81,515 people were experiencing homelessness in 2024. We were midway through the year, so we did have to estimate till the end of the year. We're going back right now to do 2024 and 2025 and update that assumption. That increase from 2021 to 2024, that's not a function of better data, et cetera. That is just an increase, a fairly substantial increase in people experiencing homelessness. Is that policy? Is that post-COVID? Is that funding? Is that programmatic? we could have a beer and talk about that. But overall, we've seen huge increases. 2016 to 2021, we saw things sort of relatively stable. So my question will be, and I guess you see it every day, is where are we at right now? Is that trajectory continuing, or are we able to kind of pull back some of those numbers? We also found, well, I'll just go over that a bit. We also looked at chronic homelessness, and to me, this is the biggest sign that we have an inflow and outflow problem. There are more people coming out of our system, staying in the system, than leaving, because there's no appropriate places for people to go, or there's not the requisite supports for people to be successful in those spaces. So back in 2016, that's about 20% of the population chronically homeless. 50% of the population in 2024. So we have people sitting in our system. Back when I started, we really used chronic homelessness as this kind of catch-all for people who maybe were very entrenched in regards to homelessness or had complex needs. It's not what it means. Right now, it's simply representing people that are stuck in a system that it was never designed for. And I'll show you here. So I think the evidence of that is 25% of people experiencing chronic homelessness are children and youth. Mind you, part of that is driven by the refugee crisis we saw in 2023, a lot of people coming in and families getting stuck essentially in emergency shelters, but that doesn't totally explain it. And so certainly having 25% of people being children and youth is, I think, indicative to me of future issues to come. Indigenous homelessness, we did a bad job. I don't think it's right. That's in part because of the data we're relying on. So because we're relying on system counts or people who touch the system, therefore we're relying on one, categorizations of people in the front line on whether they're Indigenous or not, but two, many people don't touch the system for various reasons, systemic racism, unfair, unjust shelter bans, et cetera, et cetera. So what we have here is 10.6% of people experiencing homelessness within this kind of sample. When we looked at the northern population, though, it did account for people with Indigenous identity, accounted for about 44.6%. So as Michael mentioned, us relying on system figures produces this, and so we've been thinking, how might we improve this representation? As I mentioned, of course, we saw a number of refugee and asylum seekers in the homelessness emergency system, which is not the best place often for people who are refugees or asylum seekers, and really indicates to me, frankly, a failure of two federal government departments. So there's an entire settlement department that's responsible for these outcomes as well, and frankly, sort of disappeared, I'm allowed to say that, over the last couple of years. So what we saw was 10,000 refugees and asylum seekers within that 2024 sample experiencing chronic homelessness, which again means people are getting stuck in a system. We also wanted to look at funding trends for homelessness and housing, and this is a little bit different in Ontario because of that legislative responsibility, so that funding does flow through the service managers. But what's been happening, and any of you in your non-Ontario communities, is voters, media, people with homes, people without homes, don't care what order of government is responsible for housing. That's silly to keep saying to them, well, no, it's a provincial government. So what's happened is municipalities have started to put in quite a substantial amount of money, you can see in homelessness and housing, this yellow line, into issues of housing and homelessness. However, there is reluctance or resistance in some instances because it's perceived at a municipal level, not just in Ontario, that once you start doing that, then there's precedent to continue to do it. So there's a mandate creep. However, as we can see, the funding has increased. At the same time, that line I showed you of the number of people experiencing homelessness is going up just as fast. So we're putting more money in, more people and families are experiencing homelessness. So what does that mean for what we're spending and how we're spending? Okay, so this is where we looked at the projections, and this is the kind of the headline, if you will. This is the newspaper part, and you need one of these. So what we did under each scenario was looked at the levers that are related to economic downturn, economic kind of steady, and then upturn. If I were a betting woman, I would say we are somewhere between steady, closer to downturn, and significant impacts of tariffs on employment, et cetera. So we see that approaching 2036, estimated nearly 300,000 people would be experiencing homelessness over the course of the year. Investing in solutions. I show this every presentation, and this part this works for organizations, it works for programs, it works for municipalities, we're doing some work with provincial governments. These are the 4 things you need, and if you have them, you can do a lot. I will say what's missing is the qualitative experience of people in those systems, which should not be forgotten. But you need supply. What's the inventory you have across the service continuum in question? Demand, how many people and where are they? And thank you today I was so happy to see your supply and demand slide. I was like, yes. And then performance, what are the outcomes achieved? Also linking to that is financial. So we are in a period of real government tightening. I think you saw in Ontario probably the hiring freeze. We will see fairly significant, I think, federal budget cuts and staffing cuts. Government of Alberta also is going through its own review. And so that makes this financial argument perhaps uncomfortable, but essential. How are your financials tied to your supply, to your demand, and your performance? And so if you have those 4, you're able to link those, which is what we did in this project, you can really get some of those action pieces. So, take a photo of this. This is all you need. Collect this. And as I said, you should also understand the experiences of people using these programs to assess quality, equity, and outcomes. If you can jam those together, you have yourself a performance framework. All right. What this allows us to do is make a disimpassioned argument as to why we need to build the right thing. And are they in the room? No, I don't think they're. I was in a meeting with an Ontario municipality, and we had done all this modeling, same as this AMO approach, but just on a single community. And I said, well, you can do this, this, or this. He said, okay. And essentially the middle scenario was to spend a whole bunch of money and do a bunch of work to get back to homelessness as it was 10 years. So in 10 years, as it was now. And he said to me, so we're gonna do all of that work only to get back to where we are today. And I said, yeah, you're gonna wish you were there. And so that really propelled forward a conversation about, no, we need to do more than that, and how might we be creative? And so showing things like this of, okay, if we were to double shelter supports, this is just a fake community, that's tiny. What would be the overall costs and what would be the overall outcome? 2, we can increase homelessness-facing supports only. So really focused on medium acuity supportive housing and transitional. 4, less money. So that seems like the good one. Or we might invest in deeply affordable housing, higher acuity supportive housing, higher cost supportive housing for those more complex needs, which says nothing of the health system, and I appreciate your presentation, Mike. And overall, that doesn't really cost that much more in the grand scheme of things. We do have a tool that you can do this. You can play around with this. It's free. I'll give it to you. I should have put it on here, but it allows you to kind of do some of that calculation. But getting back to this project. So what we did is the exact same thing, but we just did it at scale. Our projections include the supportive housing that's required from that really mental health focused, and so there, as I said, needs to be proportional investments into all of those other areas for this to work. What we had was $11 billion to end chronic homelessness, so that was 75,000 new spaces. including supportive housing, transitional and deeply affordable, expanding prevention to reduce inflows, that system getting stuck, and then focusing on system optimization. This assumes you can put all the spaces in at the same time. It is agnostic in some sense of geography, et cetera, but what it serves is to put something on the table to say, can we achieve this? You will never, ever get that number, but if you say that number, then you can do as much as you can to try to close that gap between what's possible and what is ideal. Then we flipped it. We said, okay, that's a lot of money. What if we said, if we only had X, how might we best spend that? And that's also helpful, as you know, in kind of funder negotiations, government negotiations. You start with the number and you work backwards. So we said, we think, of course, at the time, well, currently, for government priority really was encampments and removing encampments, frankly. And so we said, how might we jumpstart that to improve community, family, well-being, and safety, including those experiencing homelessness? So $2 billion over 3 years, we thought would kind of jumpstart that system, which will include 5,700 new housing spaces, and then transitional support. So we really focused on that kind of middle part of the continuum with less investment into that deeply affordable, which of course has knock-on effects. I think having both of those, Michael, I don't know what you think, having both of those was an advantageous framing, if you will. That's it.
All right, that's Jesse Donaldson, Help Seeker Technologies. Thank you so much, Jesse. Great presentation. Now we're going to move to the Q&A portion. So if you have a question for any of the speakers, please come up to the mic and ask your question. If your question is in French, I'm going to run and get a headset and try to do some magic because I don't speak French, but we'll figure it out. The translators are here. All right. Thanks so much.
Bonjour tout le monde. Good morning, everyone. I am Patricia Franks. I'm from the Intentional Community Consortium. We advocate for those with developmental disabilities in getting housing built. So I had a couple of questions for the second speakers. First of all, wonderful data collection. Can it be shared? So one of the challenges I believe for a lot of not-for-profits is the lack of capacity to do our own data collection, but the need for data in order to bring forth our cases. So we've run into the barriers of, oh, we can't tell you that, we can't share that with you. One agency and another agency not sharing between them because of confidentiality. So that would be a real asset for all the not-for-profits to be able to have some data sharing, to be able then to bring forth those arguments.
I'll just speak loudly. Can you hear me? Yeah.
You want to go to the mic?
Okay, sure. I agree. Because data is currency, and in a resource-scarce environment, we hoard what we have, our assets, and sometimes it's a technology function, and there is obviously a confidentiality issue. Certainly, we put a lot of data in the report. I'm going to tell you exactly what you don't want to hear. It's not mine to share. But I appreciate how challenging that is, particularly on an organizational level. To work with. I will say Infrastructure Canada recently has done some moves, I understand, to make more data. Anyone in the room here for Infrastructure Canada? No, okay. More moves to make data more transparent, and so communities sharing on an aligned framework, but I appreciate that we have a long way to go.
Yeah, because really what we need is numbers, not names. Yeah. Was the population of those with developmental disabilities included as a subsection at all in your data collection?
Hello, okay. So that is one of the things, when I said that we had to make compromises on what we learned because we wanted the 100% inclusion, unfortunately getting into the who and how are experiencing homelessness, that was one of the pieces that we didn't go as deeply, so that we didn't have, unfortunately.
Yeah.
I will say there's some other work going on right now in Canada looking at linking disability payments, who's on there, with people experiencing homelessness data sets and trying to build those cross linkages to say, hey, we've got Joe in 5 of our streams of systems. How might we better support him at a system level?
Yeah, because we know between 18 and 20% of those that are homeless have developmental disabilities, at least in Ontario. That's, from our thing. And the other question is, and maybe for all the panel to have a look at, I know the not-for-profits are very good at connecting with each other, especially for the AMO. Do we get connection with the developers and the builders who should be partnering because they're the ones with resources that we can access?
Yeah, let's go.
Oh, sorry.
So I'm just speaking at the podium for the simultaneous translation. Good point. AMO is willing and working with all available partners that we can. We are trying to open up a dialogue with the private market developers about how they can contribute to this solution. I can't really report out on what progress we've made at this particular point in time, but it's something that we're definitely considering, and it's a great point. Thanks.
I'll just go back a step to one of the earlier questions around data real time. So CAH, we get real time data from 62 communities across Canada right now on a monthly basis. So you can have a conversation with me or attend the presentation in the afternoon. Notably very different than what Jesse and HelpSeeker have done, which is fantastic report, which is really comprehensive. It's just a different space.
Do you get the data from British Columbia?
We're working on getting it from BC.
Why don't you get it from BC?
I want it, Mike. All right, next question, please.
Hi everyone, my name is Keir MacDonald, work with an organisation called Coast Mental Health in BC. Firstly, panellists, awesome presentations, really appreciate Mike. I had seen some of those stories, the videos, really accessible, love the qualitative storytelling, which made me wonder if that was backed with what we saw, which is the numbers. I think what we often don't talk enough about in the homeless serving sector is the cost of the solutions. So I wonder, and just love if perhaps, from that impact reporting piece, naming all the problems and the solutions, but then backing that with costs. Maybe that's an extra piece, Mike, for you. Or did you look at that one?
I'm going to speak to that really quickly, and I appreciate that, Keir. As piggybacking first off what Mitch said, we are working in our province right now. We talking about by names list was one on your slide. We in our province of British Columbia, we don't actually have a functioning HIFIS system. So our municipalities and our nonprofits don't collect that data. We're working on that. Hopefully we get it soon. But to your point about that, very valid point. And as a municipality, recognizing that we look to the province and senior government for funding and resources as we go through this the next year to develop a more robust homelessness action plan. It's going to be filled with the cost of, and not just what is municipalities' responsibilities and roles, but whether they sign off on it or not. What are the provincial roles and responsibilities, and looking at trajectories as well? What are not only our actions, but our numbers and our needs, and how do we meet those needs over the next 5 to 7 year period? So very valid, not just the cost of, but the cost to support as well. So thank you.
Thanks, Mike. And just a quick follow up on the Ontario folks. Chronic homelessness, very similar picture to BC. Those solutions, those costed solutions, what I'm curious about is the health costs. Were they factored in? I just wasn't clear in the presentation, because for us, you seem to downplay a little bit in terms of the chronic homelessness and who's part of that, but for us, what we're experiencing is incredible health complexities, substance use, mental health, chronic health, comorbidities, which is only aggregating the cost of addressing the issue, and also not getting everyone in the room that needs to be in the room. So love, again, the data that you've shown, but if you could just bring to life a little bit, where does the health piece play into that?
Yep, that was the decision not to include the proportional health spending or quantify it was a conscious decision to draw the box somewhere, and also to try to make the point that it can't, so service managers have legislative responsibility under the Housing Services Act for housing and homelessness. What that then turns into is a de facto responsibility for things that they actually don't have a downloaded mandate for, such as health. And so absolutely appreciate though the experiences of people also facing chronic homelessness with mental health and substance use. I will say we're working with a project with Reaching Home right now to look at common service trajectories across 3 communities and proactive versus reactive services. And I think that's a challenging binary, but we're looking at utilization journeys and then costs, health, justice, homelessness, et cetera. And you're going to get an email from me after this, Mike, because I think there's a lot we can learn from those service journeys that kind of you had done. So stay tuned for that information as well. And I anticipate that that'll be available around January.
Hi, I'm George Clayton from the Canadian Urban Institute. Really appreciate the presentations. I had a question on the modeling that was done for the cost of bringing to zero. As we all know, homelessness has a cost right now, whether it's inefficient use of services or to municipalities or businesses. I wondered if those avoided costs through these investments were factored into your modeling.
No. But to that point, that's why we were so enthusiastic about this next project, is we really view this as a knock-on so that we're able to look at some of those pieces. But that was, again, I guess, a conscious limitation of where we decided to draw the box. But you are right.
Thank you.
You should just stay there, Jesse.
Sorry to make you sit down again, but it's going to be a question for both. I'm curious from the quantitative and the qualitative. But my question, sorry, my name is Ian Stratton. I'm from Thresholds Homes and Supports in Kitchener. My question was with regards to youth and how, as we all many know, probably in this room, that when someone leaves the supported setting after they hit 18, what have you, they basically go from a supported setting to a non-supportive setting. So did your research from the quantitative portion kind of capture this? How did you scale for it? What was that like? And then I'm kind of curious from the qualitative if you guys were able to capture any of those voices.
I'll speak. This works. I don't have to get up. From the qualitative perspective, I mean, the research that we didn't necessarily focus on youth versus adults per se. I mean, I mentioned some numbers of spaces, for example, 24 detox beds. That's for youth and adults. But when we look at our point-in-time counts, I think the last number was about 24% of individuals who are under the age of 24. So we factor that both into what we try to collect with the limited data that we can collect, but also what do we do with those numbers? So how do we then advocate to the provincial government to build specific types of housing? And I recognize that probably doesn't fully answer your question, but I'll flip it over to Jesse to build that with the quantitative.
I've been told this works. Oh, okay. Unfortunately, no. So all we got to was the 25% of children and youth. When we did the modeling, we did make an effort to do some demographic-based modeling. We ultimately didn't use it because we didn't think it was reliable to disaggregate at that level because we had more data gaps in that demographic piece, but certainly it's its own project in itself. Where we do the youth modeling works really well at a organization level to kind of predict demand for supports as well as a municipal level.
Thank you.
Hi, quick question. On your slide about investment in outcomes, you were talking about a tool, a calculator that you would share with us?
Yeah, how do I best do that?
That's a good question.
I didn't think this through.
I apologize. I'm trying to think on the spot. The best way to receive it.
If you'd like it, my email is Jessie, Jesse, at helpseeker, helpseeker.org. And if you miss that, I'll just give it to you. It's not a very elegant solution, I'm sorry.
Great question. Something to think about for the next conference. Thank you.
Hello, my name is Ali. I'm Director of Communications at Supportive Housing Charity. I think something I'd appreciate your reflections on is just how do you bridge or combine kind of the qualitative and quantitative, because we saw some interesting kind of reports on both sides of those, into your overall strategy. So how do you balance the hard data with the storytelling aspect?
I mean, very pertinent point. I appreciate that. Working. And you use the word balance. It is a balance, right? We don't want to be overly heavy on one versus the other, but I think they both tell a different story and the same story at the same time. So I think qualitative reinforces the quantitative and vice versa. Quantitative reinforces the qualitative. So I think they're both equally important. And if we can get that healthy balance, I mean, it would be best.
Mike, I just want to give you guys, I don't, for the data nerds, which seems to be most of you, I was really struck by the ontological piece, and if you're not familiar with that, please look it up. But really, ontologies, we use one too in all our data collection, are intended to represent both quantitative and qualitative data and really be this kind of system of knowledge and language. And of course, I'm not explaining it well, but I was really impressed that you used that. And I do think that's actually, to get into it, a foundation for how you bring all of these different types of knowledge together in a coherent story and narrative.
Hi everyone, I'm Laho. I'm from Yukon Territory. I just wanted to see if you have any suggestion about like what's the best way to have an estimation about how good the by name list data is showing the real amount of homelessness. And yes.
That's a great question.
Okay.
And then I have some ideas.
Yeah, I would say when we confirm quality by name data, obviously I'm not a presenter, I work with Canadian Alliance to End Homelessness, that means that we believe that figure to be representative of 90% of the people experiencing homelessness in the community. But there are communities that submit data to us who haven't yet reached that threshold for quality data, and then we would acknowledge that they're not at that place. So we work with communities to help get them to that place. And then when they're at that quality data point, then we can start doing some interesting things by looking at inflow and outflow in the community on a monthly basis. I have a presentation later today, and you'll hear a big announcement actually with a big number. So, yeah, if you're part of that, stay tuned.
Something we learned through, and because we were doing it at an aggregate level, it is not to get too precious with it. So our whole thing was, how do we make some responsible and conservative inferences for missing data, and how do we know when we need to do that? And so we did ask communities for basically every number. It was a huge pain, and thank you to the service managers, to give us kind of an accuracy score. How much of your system do you think this represents? And actually there's good studies that if you ask 5 people with a particular similar experience, if you ask 5 people, you'll get to the answer that's correct. So asking more people doesn't actually help that much. So the purpose of that is we were able to figure out, oh, that needs to be adjusted up a little bit, or oh, we need to look at the historical data. Oh, we need to put the PIT data in instead. Oh, we need to do research on similar sized communities. So we've really looked at every single data point and figured out how best to do that. So with total respect to the work you guys do, it doesn't need to be perfect for action.
Yeah, absolutely. And I'm going to go back to an anecdote, an example when I worked back in community actually. When I first got out of my Master's of Data Science degree, I went right into the sector, and within 2 weeks I was doing a data analysis, and basically I could see through that data analysis that everybody was only looking at data in the shelter, and they weren't actually counting the people outside. And there was going to be 143 people forced to shelter outside that winter, and the city was expecting 20. So just be careful when you're looking at data, and really ask those big questions about, do you have all the data sources as you speak, being comprehensive about what you're doing.
Yeah.
Thanks.
Maddie, also from the Yukon. Jesse, you talked about the almost doubling in funding over the past 10-ish years. Do you know how much of that is emergency funding versus funding for like supportive housing or related services? And then kind of a related question. When you're doing that advocacy to funders and to elected officials, what are the messages that are landing around increasing investment and the right kind of investment?
Yeah. Forgive me for not remembering, but yes, we do break it down in the report the best we could. Categories are tricky. What's supportive housing? What's emergency? We tried our best. So there is a breakdown in the report on that. A lot of it's to housing funding, but I'm almost certain there's a breakdown.
Yeah, in terms of the advocacy, I think one thing that we'd like to turn more of our attention to is the return on investment argument, the cost avoidance argument. I think that's something that would resonate with our particular provincial government. I mean, there's a moral argument, an economic argument, but appealing to the government of the day, I think, is where we're going to be gearing toward.
I know we're probably at time, but what's been resonating for you?
That's a great question. I appreciate flipping that over, Jesse. Great question. I work for a municipality, and Jesse used the term, I think he used the term scope creep or government download. I think there's a great big fear in municipalities of the more we do, the more we're expected to do, and that's not to say that doing the doing is not important. But the common narrative that comes out of local government is that we pay our taxes to the provincial and the federal government. They get a significant impact of it. We take our property taxes, and our property taxation is for local services, for individuals, where a lot of the responsibilities that we're talking about here come from provincial initiatives and provincial funding. So there's that fight, that argument of how much of this do we do when we're already paying for it to be done, in the absence of it actually being done, and what is the best prevent? What does it say? An ounce of prevention is worth a pound of something, and how do we balance that need for both our community, our taxpayers, and the community members that we're serving? A really easy example when I look at and we advocate internally is and it's not, we're talking about people, we're talking about garbage. How easy is it to clean up garbage before it becomes a huge pile, rather than spending $1 million a year on cleaning it up after the fact all over the city? How can we be proactive and ensure that we're doing some things that would maybe stop those or provide opportunities for those services to be done when they're not huge heaping piles? And again, you invest $200,000 now, you might not have to spend $800,000 in that year, and take that at scale for building buildings as well.
All right. Thanks so much to our amazing presenters. Great questions. Amazing session, actually. Emotional, intelligent too. All right. Thank you both, or all three of you. Bye-bye, everyone.